this. And if you ask, in India, maximum out of the world, maximum number of TB cases are in India. So TB is rampant in our country. So we should be knowing about the TB. And it's not that TB is few years back, TB was gone from the developed world, and it has come back again with the incidence of HIV, AIDS, and even tuberculosis. Even diabetes is so common now. So with this, it leads to immunity, affect immunity. So tuberculosis is coming again, even in the Western countries, and in India, it still remains one of the leading cause of the chest complaints and the other problems. So with this, um, what we'll be covering in this webinar, we'll be covering TB in India, how common it is. Actually, it is very common. What is the reason of the TB? It is some bacteria or something? What is it there? We'll talk of this. How, very important, how does TB spread? We know the bacteria is the cause. How does TB spread from one person to other? This is important because then we can take certain precautions. We know this is a person of a tuberculosis patients in the lung TB, pulmonary TB especially. So what precaution he or she should take? Then what are the symptoms and signs of TB? Means if these symptoms are there, we should contact the doctor. It doesn't mean these symptoms are there. It just means definitely TB. Yes, we need a diagnosis by certain X-rays, blood test, and the other tests. So what are those tests that will help in the diagnosis? And management of TB, treatment of TB is little different from all other things. We have anti-tubercular treatment, what we call, means against this bacteria. This is not normal bacteria. This is something different, very thick-walled bacteria. So this bacteria, it takes almost at least 6 months treatment. Normal antibiotic we give for 5 days, or so maybe if urine infection, sometimes we give for 2 weeks or 3 weeks. Typhoid maybe sometimes 10 days or 14 days. But in TB, we have to give these drugs against this bacteria for minimum of 6 months. And then again, how we can take care of our lung and through the various breathing exercises so that we keep our lung healthy. That is very, very important. Why? Because lungs are the organs which gives us oxygen, actually, which give oxygen to the whole body. So oxygen is a very, very important part. So we need to keep our lung healthy. And nowadays what we are seeing, there is so much of pollution, so much of allergy that leads to lung diseases. So how we can keep our lungs healthy through various breathing exercises. So as we said, TB is very common. It is a major health problem in India, cause about 2 lakh plus deaths every year. Out of the world, 26% of the TB cases, means 1/4 of the whole world cases are occurring only in India. So in India, TB is very, very common. And if we talk of incidence rate, is about almost 200 cases per 1 lakh of population. And if you compare from the Western world, the developed world, there is almost less than 10 cases. So almost 20 times more cases per population, basically what we are seeing. And when we talk of the death because of TB, in the HIV negative people and the HIV positive people, because now HIV is very common again, especially in the developed countries and some African countries. So HIV negative, 38% of global TB deaths, death occurring because of the TB in the world. Out of that, roughly 40%, 38% are occurring in India. And HIV negative and HIV positive combined together, then 34% are occurring in India. So India is like a very, very important for TB because TB is very common. It was very common. It is common, and it's not going to go away. Yes, we are doing various programs. Even the Prime Minister is also involved in this tuberculosis control programs, but TB in India is very rampant. So it's India's biggest health issues, and the worst problem is the recent discovery of drug-resistant tuberculosis. Now, this is a problem with other bacteria also, drug-resistant bacteria, because we are using antibiotic rampantly without any arrestal, without any sometimes prescription. Similarly, even in tuberculosis, what we are seeing, drug resistant tuberculosis. Now, this is important because whatever we have a tuberculosis treatment, then these medicines do not act properly on this bacteria. So we need to give injections, and that is a person has to come to the doctor, or maybe very frequently. This becomes a really problem. So we have a very common issue of multi-drug resistant tuberculosis. And apart from this, TB has a stigma. We consider TB as that's a disease of the poor or socially marginalized. So we generally, society covers that TB is a stigma basically. And we have a nowadays treatment, what we call DOTS treatment. DOTS means directly observed treatment short course. Means government has a policy. The government has made various centers which are providing the tuberculosis treatment, and they are almost within a 2 to 3 kilometers of the person's address, and person has to go to these centers and show their Aadhaar card with their address proof, because they confirm the address, and they supervise the treatment. Now, this is the very good part, that compliance is good because they get the treatment. Suppose if they miss some doses, then the health officials connect with them, and then call them or connect with them and provide the medicines. So this is a good part. But there is a associated part is, then if person is going to the DOT center, the other person feels, oh, that person is having a TB. So that is like social isolation. So with positive point, the society has a little stigma part, which as a awareness part, we should know it is so common, it can occur to anybody. So don't feel stigma, don't have that stigma that person has got TB. Now, what is the reason for this? There is a causative organism, there is a bacteria. Now, it's not a simple bacteria, because simple bacteria can lead to the infections, and somehow that generally gets over by the antibiotics within a 1 week. But this is a different bacteria, what we call it Mycobacterium tuberculosis. This is the name of the bacteria. Now, important thing is, if you see the structure wise, it has a very thick wall, very thick wall, very thick wall. So this means the medicines do not cross this wall very easily. So we need to give antibiotics, what we call, especially for this, anti-tubercular treatment for a long time. 80% cases, generally this infection leads to the infection of the lungs, what we call pulmonary tuberculosis. But apart from this, there are other organs also get affected. Now, how does TB spread? Tuberculosis can spread when a person with illness coughs, sneezes, or sings. Now, because this is infection which is there in the lungs, respiratory tract, just like we have seen in the COVID also, if a person coughs, if a person sneezes, because from the lungs, it can spread through the droplet to the other person. So tiny droplets with the germs come to the air, another person then can breathe in the droplets and germs enter the lungs. So the person who is having a TB of the lung should wear mask and maintain a proper distance with other people. So tuberculosis spread easily where people gather in crowd or people living in crowded conditions. So generally the slum areas, there we see more cases of this. More cases because spread occurs very, very fast. Spread occurs very fast because people are living so nearby. And nowadays, with the HIV or AIDS or the weak immune system, there is a high risk of catching tuberculosis than people with typical immune system. Because TB bacteria are there in so much environment, we have so many patients of TB, the immediately person is having a HIV or AIDS, then their immune system is weak. Because immunity is weak, any infection can come and TB infection can also come. When TB germs survive and multiply in the lungs, it's a TB infection, and it may be symptoms may be depending on the primary stage, or latent means just no symptom but infection is there, and active means there is an infection as well as symptoms are also there. So now what are the symptoms of a TB? Now, symptoms of TB generally it depends in which areas are affected, whether lungs are affected or the glands are affected or the bone is affected. So, if lungs, which is there in the 80%, most commonly is the pulmonary tuberculosis, what we call lung TB, then person has a cough. Now, cough can be there in even allergy, cough can be there in any viral, cold cough, but this cough, how it is different? One thing, this cough is productive. Productive means person also has some mucus or what we call the sputum, and there is also blood. So, person who is having a cough with a productive cough means some mucus, some thick material also comes, and there is a blood also comes. So if this is featured, then consider that this may be a TB. Along with this, there is a chest pain with breathing or coughing. There may be a fever. Fever is generally low grade, means generally 99 or 100, and it is generally more in the evening. Person is usually fine in the morning, but in the evening when person is tired, then he or she has a low grade fever. There may be night sweats, weight loss, very very important. There are many reasons for the weight loss. Person is dieting, or if not dieting, uncontrolled diabetes may be the reason, HIV may be the reason, and TB is also one of the reason of uncontrolled, basically not doing anything and losing the weight. Person is not liking the food, does not want to eat, remain tired throughout the day, and overall feeling of well-being is not there. So if there is a cough productive with blood in the sputum, fever more in the evening, and this cough is there at least for maybe 2 to 3 weeks, fever, how weight loss, significant weight loss, then we should always consider that it may be a pulmonary tuberculosis or a lung tuberculosis. So one should visit the doctor for this. And if other than lungs are involved, what we call extra pulmonary, then means extra pulmonary means other than lungs. And TB is so common that it can involve any site, kidneys it may involve liver, it may involve intestine, or the brain, around the brain, or the back spinal cord. It may involve the genitalia, so then the hormonal issues are there. It may involve lymph nodes, but we can have a glands in the neck, so person is having a gland swelling, bone TB, joints TB, or maybe the skin TB. The important part is if it is a lung TB, generally it gets over by 6 months, but bone TB or intestine TB or lymph node TB, sometimes treatment has to go maybe 10 months or maybe 12 months, 1 year, or surgery may be required. Now, so we talked, it is very common in India. It is the reason is the bacteria, and this bacteria is a different bacteria because it is a very thick walled bacteria. So that's called mycobacterium. How does it spread? It spreads by coughing, sneezing, or singing, means through the cough, tiny droplets from one person to another person. What are the symptoms? It depends on pulmonary tuberculosis, lung TB, or the extra pulmonary TB. Now, how we diagnose it? There are various tests. One very common test, what we call a MON2 test, skin test. What we do is in this test, in the skin, we do the some injection in this and test for to see whether how much is the reaction. This we see reaction we see after 48 hours to 72 hours. So at the in the forearm we inject some tuberculin, what we call purified protein derivative. This is a chemical, and see how much is the reaction. And we measure the reaction, means how much in the skin or area, maybe 5 millimeter, 7 millimeter, or 10 millimeter. Generally in India, we see above 5 because all are vaccinated against the tuberculosis. So mild reaction is there. But if it is very high reaction, maybe more than 10 millimeter reaction, so we say MON2 test is positive. And then pulmonary TB, which is 80% of the cases, then we do the chest X-ray. It's not that 100% cases the chest X-ray can pick up, but most commonly, first thing we advise test is a chest X-ray, and in many cases, it can pick up the tuberculosis. And then, as we said, the person is generally having the cough, productive cough. So there is a sputum, and in that sputum, we do the bacteria testing, what we call AFB. AFB means acid fast bacilli. This is called acid fast bacilli because this bacilli, I've already told you, this is very thick walled, very resistant bacilli. So this is so thick that even acid cannot penetrate it basically. So we need special stains, what we call acid fast bacilli, and on that we see this is, if you can make out, these are the red, these are the beaded means dot is there in between. So these are the bacilli which is there in the cuff. So this test is a diagnostic where we see the bacteria. If we have seen the bacteria, means there's no doubt in it. So sputum for AFB test is a very specific test what we do for this. Apart from this, other than lungs, it may involve the lymph nodes, it may involve the gland, it may involve the intestine. So depending on the site, lymph nodes, again, apart from the lungs, lymph node is a very common site, especially in the neck. Then we do a test called FNAC, fine needle aspiration cytology. We do the needle prick, and through the needle we take out the material and see whether the TB is there or not. Or otherwise any organ inside bone, joint, intestine, then we require CT or the MRI scan, and sometimes a biopsy is taken. जिसे बोलते हैं टुकड़े की जांच. We take out some piece of it organ and then do the test. If there is a fluid, maybe in the fluid around the heart, pericardial fluid in the abdomen, what we call ascitic fluid, we tap and see the AFB. Nowadays, new tests are available, what we call PCR test, that is available for TB, some TB gold test, which is done a blood test, and ESR is very high. These are the common tests, complete blood count, ESR, and adenosine deaminase test. These are also helpful. Nucleic acid amplification test, these are very latest because we have seen the AFB positive. Now, if in 1 ml, 2000 bacilli are there, only then we can see. This is the sensitivity level. But NAT test picks up the bacilli even if 50 bacilli are there in 1 ml. Or the gene test, again, these are very latest and very reliable. Not everywhere present, but if we suspect, definitely we should go for these tests. So this is the way how we diagnose it. X-ray remains the one of the choice. The sputum for AFB very common, for especially for the lung TB. Now the treatment part is very, very important here. Why important? Because if we do not do compliance properly, then persons leave the treatment in between. We see this, and then the problem of a drug-resistant TB starts. So the treatment is given for a long time. This we know because bacteria is tough. Here we give treatment if it is a lung TB. So we divide it into 2 months and then 4 months. In 2 months and 4 months, when it's 2 months, we give strong medicines basically and 4 drugs we give. So first 2 months, 4 drugs are given, then 2 drugs for 4 months. So this is the basic general rule. So 6 months treatment is there. So initial 2 months we give a high doses basically. So we need to combine 4 antibiotics, 4 anti-tubercular drugs. So this is the pulmonary treatment. But yes, if before stopping the treatment, generally we get a repeat X-ray, see the clinical examination, or maybe some blood test also, depending on whether we need to stop, or if there is even some evidence is there, we may continue for 1 or 2 months. But if it is extrapulmonary, means other than lung, definitely 6 months are not enough. We need to give for 8 months, 9 months, or maybe more than a year. So we keep on seeing the patient, doing the various tests, and see when to stop it. Compliance is must to prevent MDR TB. So that is the very important, because here is the issue, because it is a treatment for long time, and after maybe 1 month or 2 months, that person feels all right. Generally, initially person is having a weight loss, tired, fatigue, but after 3 weeks or 4 weeks, that person becomes better, starts eating, feeling good. So then there is a very high chances that person says, okay, I'm fine now, so let me stop the treatment, or I'm going out, so I'm not taking treatment. So these are the very big issues. So the we need to be aware that this treatment has to be taken in a complete manner for the whole duration. Yes, we need this treatment under medical supervision, and stop only after advice of a doctor. Very, very important. Now, who are at the risk factors basically? Persons at a high risk for developing TB fall into two categories. One, who have been recently infected with TB bacteria, yes, and other people in whom there is immune system is weak. Now, immunity may be weak because of some medicines, immunity may be weak because some age factor, or the some drugs person is medicines person is taking, okay, or the diet is not proper, not a healthy life, then also immunity becomes low. So we will be talking on this, how we can improve our immunity. So persons who have been recently infected with TB bacteria, like a close contact of a person with infective TB, person who have immigrated from area of the world with high rate of TB, suppose from any area where TB incidence is very high, that person comes to the different area, that means that person can spread. Children less than 5 years of age having a positive TB test because their immunity is weak. Groups with high rate of TB transmission, just like a homeless person, IV drug abusers, and person with HIV infections. There also TB is very common because of low immunity. A person who work or reside with people who are at a high risk for TB in facilities or institution like hospital, so healthcare worker at a very high risk factors, and even the family of the healthcare worker is at very high risk. Persons who are living in homeless shelters, or the nursing homes, or the residential homes for those with HIV. So those persons who are living with these persons are having more exposure of the TB bacteria. And persons with medical condition, like the apart from the age also, so babies and young children often have a weak immune system. So if there is somebody in the family who's having a TB, please keep them away from the children. Other people can have weak immune systems, like especially people with any of these conditions like HIV infection, is called human immunodeficiency virus, which ultimately leads to AIDS. AIDS is acquired immunodeficiency syndrome. So HIV infection is a virus that leads to the disease, severe disease, which is AIDS. Drug abusers, diabetes. Now diabetes is very, very common, and we know in diabetes sugar levels are high. So any infections, uncontrolled diabetes, any infection can lead to, and tuberculosis, because it is so common, so even in diabetes tuberculosis infection can occur. Severe kidney disease. Now again, kidney disease, what is the importance of kidney? Kidney is a very important cleaning organ. Now, if it's not working properly, this means body toxins, various chemicals are there in the body. So that toxic waste products remain in the body, that leads to low immunity. If person has a low body weight, again we do not recommend the dieting as such, but those persons who do a dieting just for and not eating suddenly and losing a weight loss very fast, they get a low immunity, and then there are very high chances that they catch up various infections. That's why we say do not lose the weight very fast. Organ transplant. Organ, those who receive the organ like liver or a kidney, because they're we give them medicines like steroids to suppress the reaction, so their immunity becomes weak. These persons are more likely to get the infections, or the persons who are having a cancer, or the persons who are taking a treatment like a steroid, especially the arthritis cases or the autoimmune conditions. Then they are, because taking this treatment which leads to immune suppression. So any treatment, any condition which leads to immune suppression, they are more at a risk, because TB is there, uh, just surrounding us, and many cases of TB infections are there around us. Yes, diabetes. One in four people with TB also has a diabetes. So diabetes, if in a diabetes person, we should get the X-ray done, and in a TB patient, we should always get the blood sugar done, because we know these both things can coexist, especially in 25% cases. So diabetes is a chronic disease which affects how the body turns food into energy. So in this, there is a sugar is high, and TB is a serious health threat with the diabetes, because in diabetes, immunity is low, sugar is high, and when TB comes, generally it leads to a severe infection. It's not only the active TB disease can lead to, and then we need to give treatment also, little more harsh treatment. HIV and TB. 1 in 3 AIDS-related deaths in 21 were due to tuberculosis. Now, HIV is a virus which is there, it has been covered in the whole world nowadays. And thank God nowadays we have a medicines for this. We know how it spread. So we do the various awareness program. So somehow we are here now, we have contained the spread of HIV to a large extent, not in the whole world. It is high in the African countries, but in the developed world and even in India, we have contained the spread to a large extent. But the problem is there is that HIV damage the white blood cells of the blood, which are the immune cells. So because it is destroying the immune cells, so it leads to immunodeficiency. And whenever there is an immune deficiency, means any infection, what we call opportunistic infections, means they normally do not lead to any infection in the body, but when they get opportunity means if a person is having immunity low, or maybe person is having some treatment which is making that person more sensitive, then any infection can come. So in India, many opportunistic infection we see, but TB, because it is so common, that very commonly HIV person gets a TB. So any patient who is HIV positive, we also get the TB test done, even if there are no symptoms. Or if a person is having a TB, we also get the HIV test also done. Whether there is an immune deficiency because of this infection that has led to TB or not. So in a TB patient, get the blood sugar done, diabetes is there or not, get the HIV test done, whether HIV or immune deficiency is there or not. Very important, because if these are the reasons, then we need to manage a little more differently. So HIV infection is a very important risk factor for progression to TB disease, especially a person, if one has both HIV and TB, then it is more likely that TB will be more severe and HIV will also be more severe. So HIV ultimately lands into a disease what we call AIDS. And when TB is there, then HIV multiply very fast. So that means then there are more chances of developing AIDS. And that the more chances of developing AIDS early also in the HIV. So this is the reason, if TB is there, we get HIV test done. If there is HIV is positive is there, we get the TB test done. So we always follow up these persons. So TB remains the leading cause of severe illness, what we call AIDS, and death among people with HIV. Very important. Friends, we talk of prevention. And on World TB Day, we need to talk on this. Can we prevent it? Two things are there. We can prevent it, because it is a infection which spread from one person to other person. So the person who is having a TB should take a precaution so that it does not spread to the other people. And if we are having immune, we should not have a low immunity. Yes, in the SDG goals, we have planned that world's infectious disease should be terminated by 2030. Let's hope for the best. We have a vaccine against it, BCG vaccine, that we call. This is given to every child at birth in any health center, whether a government health center or a private health center. The moment within 24 hours of a birth, a BCG is given. It is given at birth, but it does not always protect people from getting TB. This is the issue. It is not 100% protection. But yes, important thing, it protects from a severe disease. Still, it does not give 100% protection, but because it protects from severe disease, that's why we give a TB vaccine. Nowadays, new vaccines which are more effective, more preventive, better, they are also under trial phase, and we hope that we get a very latest and the best vaccine available. Now, we've talked that immunity becomes low, more chances of TB. So what is that immunity? Immunity is body's capacity to fight with the various infections. So if a person is getting sick again and again, getting repeated infections, sometimes throat infection, sometimes stomach infection, sometimes other infection, then it means person's immunity is low. Now, that leads to low productivity, that leads to absenteeism, so that leads to basically a low efficiency. So we want to improve the immunity, and most of the things we have talked during COVID, immune boosters, we'll be talking of this as a natural things to improve the immunity. Now, immunity is inherited or acquired. Inherited means whatever the child gets antibodies from the mother during that 9 months in the pregnancy start, then the mother shares the blood, the cells to the child in the uterus, in the womb, then that is the immunity which develops, which is called inherited. And acquired means whatever we take from the vaccine, of the infections are there in the atmosphere, and then that comes to the body makes some antibodies against it, and that is called the acquired. So immunity is two types, inherited or acquired. And if we talk medically, there are two types, antibodies or the cell mediated. Either we have some hormone, chemicals, antibodies, what we call, or the cells take part in the role. In TB, cell-mediated immunity is important part. There, these 6 tips, these are given by Center for Disease Control USA. One is a very reputed center, what we call CDC, as a medical part, and they have given these 6 things to improve the immunity. Eat well. Eat well means eat healthy. And somehow we are eating a lot, but we are eating unhealthy things now. So please take part of this. Eat healthy food, and just not eat healthy food. We want to be physically active. Again, this is a very important part, especially post COVID. People are giving the working from home, flexi hours, and that is sedentary life, no activity, no physical activity, that also decreases the immunity. And somehow these two things are correlating and maintaining the weight. If we are eating healthy food, doing proper regular activity, our body weight will be maintained. And but if we are not eating healthy, we are eating unhealthy, junk food, and not having active life, then our weight will be overweight, obesity, and that is leading to the low immunity. Sleep is a very common problem again. 40% of the people nowadays are not sleeping properly. Maybe because of the stress, maybe because of the meetings, odd time, and very important, we are using gadgets, electronic gadgets till late uh, maybe by the time we try to sleep, and we are checking our WhatsApp or the mail till that time. What happens actually? The brain gets a signal that it's becoming dark, so let me sleep. But these gadgets, maybe laptop or the computer or the TV or the mobile, they emit such a blue light, and they activate the brain and gives a signal, no, it's not time to sleep, remain active. So this is the issue. uh, we are using these electronic gadgets so much that our brain gets a signal, no, no, this is not time, it's not time to sleep. So please do not use electronic gadgets at least 1 hour prior to sleep. So get enough sleep of 6 to 8 hours. Say no to smoking again, and even to excess alcohol. The best is to even to alcohol, no smoking and no alcohol. But again, we are seeing nowadays the stress level is becoming high, and the issue is these are not good things to manage the stress. People say, okay, stress is, there's a high level of stress, targets, job, family pressure, and then by smoking or by alcohol, I'm reducing the stress. No, they are not reducing the stress. Actually, they are further damaging your body more. Actually, the stress is damaging your body, the smoking is further damaging the body, excess alcohol is further damaging the body. So do not give the excuse for smoking to the stress. So, friends, eat healthy, be physically active. If you are doing both things, definitely you will maintain a healthy weight. Sleep for 6 to 8 hours. Do not use electronic gadgets at least 1 hour prior to sleep, and do not keep your dinner very heavy. Say no to smoking and the excess alcohol, or to even to alcohol, and that will improve your immunity. So, in the diet, again, what how to eat healthy? We need to eat a balanced diet. In balanced diet, we need a carbohydrate, protein, fat, and vitamins. Now, in the carbohydrates, again, we have healthy or unhealthy food. Now, what is healthy? Healthy is whole grain cereals. Whole grain cereals is like a atta, multigrain cereals. And the unhealthy carbohydrates are the refined cereals. Refined means no fiber, what we call maida. So there's a big difference between atta and maida. Atta is whole grain, and that is rich in fiber, which is good for our intestinal health. Maida, refined flour, which is the thing in there in the chole bhature or the kachori or the bakery items, or even the noodles, pizza, pasta, or the burger. That is the refined flour. There's no fiber in it. No fiber, it's unhealthy for body. And what we are seeing, this refined flour, unhealthy carbs are leading to the even to the intestinal cancers also. So there are many issues. So better you have a healthy carbohydrates. You can add the millets. They are very healthy for environment. They are very healthy for the body. uh, they are rich in fiber and even rich in calcium. So the jowar, the bajra, the oat, the ragi, proteins, very very important. Again, eat natural protein. What we are seeing nowadays, people go to the gym and then they get the protein from the gym. Physical activities in the gym is good, but do not buy that protein from the gym. What is happening is those who are taking the gym protein, we are seeing people, there are heart, in the heart there are EC changes, the kidney changes, the liver changes, means that is affecting these, there are some chemicals which are affecting our body. Now, fat is, I'm not saying no to fat, but do not eat too much fat, fried food. What we are eating almost daily, the snacks, the samosa, kachori, bhature chole, pakoda, this all fatty fried food. Now, why I'm saying fat should be restricted? Because our physical activity is less. And 1 gram of a carbohydrate or a protein gives you 4 calories, but 1 gram of fat is not giving you 4, it's giving you 9 calories. So fat is giving you almost double the calories of a carbohydrate or protein. So fat amount should be restricted. And then comes the vitamins and minerals. These are very, very important because they are coming from the fruits and vegetables. So eat plenty of fruits and vegetables. And in the fruit, as we say, an apple a day keeps the doctor away. So apple means not just apple, a variety of fruits. Variety means in color. So make your plate colorful. They are good source of fiber also. And what else? An immunity booster like the citrus fruits, like the orange, lemon, amla, gooseberry. That's rich in vitamin C, which is helping in various healing of the body. Broccoli, which is rich in vitamins. Garlic reduces the cholesterol and blood pressure. Red bell pepper, ginger, which is very commonly we use whenever there is a sore throat. So it reduces the inflammation. The green leafy vegetables, the spinach, they are rich in iron and antioxidants. Generally, people say, I'm taking probiotic. The curd, what we use very commonly, curd is a probiotic. Turmeric, we use in our kitchen. So these are all the basically spices what we use. So Indian kitchen is a rich source of immunity actually. Almond is rich source in vitamin E. We have a seeds like sunflower seeds, chia seeds. They are rich in zinc, molybdenum, phosphorus. Green tea. So black tea and green tea, if you say, whenever we add milk to the tea, its effectiveness becomes less. In green tea, generally we do not add the milk, so it has a chemicals which improves the immunity. The fruits like papaya, kiwi, and kiwi is a blood thinner. Blood thinner, normally we give a aspirin medicines generally to the heart patient, and kiwi is a natural blood thinner. So these are the ways how we can improve the immunity, especially in the diet. Eat a lot of fruits and vegetables. So today is a World TB Day, and on this day, yes, we say we can end the TB, and the development goals also say by 2030, country is planning that. Yes, definitely, though it's a very difficult target, but we are hoping to achieve to a large extent. And why on 24th March we celebrate this TB Day? But he's Dr. Robert Koch, who discovered this bacteria. Because he discovered this bacteria, now we know this is the bacteria, we have the treatment against this. So this is important. But unless TB is eliminated, World TB Day won't be a celebration. We are not celebrating it. We are doing awareness basically, so that how we can end it, how we can prevent it, how we can stop the spread. Various programs government of India is doing: National TB Control Program, TB Elimination Program, what we call TB Mukta Abhiyan. Ministry of Health and Family Welfare is doing a lot of activities. Even the corporate social responsibilities are involved. In Hindi, it's called a Share Rog. So Ni Share Mitra, various one who helps the persons, donors. There are digital portal. The government also does some financial support, gives a medicine free of cost. All the tests are available free of cost to all the health centers. Even the global World Health Organization is involved. And there are many, because nutrition is poor, so we give the nutrition program also in this. And this is also covered under Ayushman Bharat Digital Health Mission.
सोनू के घर पे चाय के कप से ज्यादा इनाम में जीते हुए कप है। घर का हर एक कोना गवाह है उसकी काबिलियत का, उसके जुनून का, और शायद उसके इरादों पर लगने वाली उस धूल का। क्योंकि सोनू के पिताजी को टीबी है। न जाने कितने बच्चों के सपने टूट जाते हैं टीबी की वजह से। टीबी ऐसी बीमारी नहीं है जिसे हराया ना जा सके। जरूरत है इसे पहचानने की और पूरे इलाज की।
Yes, जरूरत है इसे पहचानने की और पूरे इलाज की. Very, very important message. compliance and complete treatment. Prevention for the lungs health. Prevention is always better than cure. So how we can keep our lungs healthy and how can improve our immunity also. Say no to smoking. Smoking leads to many diseases. And as I said earlier also, people are telling this, I'm having a stress, so I'm doing smoking. That's not a good part. Whether active or passive smoking is actually bad. And if you see the smokers, this is non-smoker lung, pink, healthy, and this is like the black, irregular, fibrosed. If lung is like this, then this lung will not be able to expand and provide oxygen to the body. So this is the very big issue. And we know that smoking leads to lung cancer, but smoking leads to not lung cancer. Smoking can lead to the mouth cancer, food pipe cancer, blood cancer, kidney cancer, uterine cervix cancer, lung diseases. So many cancers can occur. And 27% of the cancers occur by smoking and the tobacco. So we can prevent a large number of cancers just by reducing the smoking. It's not only the cancer, it can lead to many lung diseases. So again, how we can keep our lungs healthy by doing the breathing exercises, deep breathing exercise. More we breathe in, breathe out, alternate nostril breathing, what we call alom vilom, the om chanting or the makar chanting. Now this is the normal breathing. We inhale and then we exhale. This is a very short time exhalation part, and this is 4-second breathe cycle. That means in 1 minute, 15 times we are breathing. But in the deep breathing exercise, we take more inhalation more, and then exhalation is also for a long time. So more exhalation means all the lung tissues inside alveoli, the gas exchange occurs more because that is cleaned, and that reduces as such stress also. So the need for the smoking also becomes less. It keeps lung healthy. I'll just demonstrate how we can do it. Take a deep breath. This is the exhalation should be prolonged. Apart from this, any exercise, if you are swimming, you are doing cycling, you are gymming, running, if you are not doing it, walking. For how long? 30 minutes in a day, half an hour. Mild to moderate exercise means at a speed of 4 to 5 kilometers per hour, means walk for 2 or 2.5 kilometers. This is minimum. More than this you can do. This will again improve your immunity, keep your body weight under check. Hand washing is again very, very important. Even during the COVID time, we've talked of this. If there are germs which are there in the hands, then we can inhale them. So wash the hands thoroughly. Cough etiquette, very, very important. Somehow, these are the issues. Anybody coughs or sneezes on the other persons, please tell the other persons that have proper cough etiquette. Cough in the mask, cough in the handkerchief, or cough like this, so that it does not spread. Especially in the public places, we should use the cough etiquettes. Mask, there are different masks available: cloth mask, surgical mask, N95 mask. Cloth mask prevents only from the dust. There's triple layer surgical masks that are effective, especially for the virus or bacteria. N95 mask is generally for the healthcare persons because it has to be worn very tight. So under guidance, basically, one we should wear the N95 mask. And air pollution is affecting the various organs. Definitely lungs are affected, and so it affects brain, it affects heart, liver, spleen, reproductive system. So it is involving the lungs. So please take care of the lungs during the pollution days. And we have various options, not the everything, but yes, whatever we can do. Indoor plants, use electronic vehicles, use the public transport, carpooling. The if There is so much pollution, especially then we should not go out. Work from home should be allowed. And we are a democratic country, so why not talk of this with the political parties? Yes, I have my right to breathe. So when we put a pressure on the political parties, then definitely government also takes some part in the taking control of the air pollution. So friends, we come to the end of this session. Just to summarize it, we talked about TB and respiratory health. TB is treatable and curable, means we can completely remove the infection from the body. With the treatment, yes, we know treatment is slightly long, so we need to be remains aware and this compliant. Still, people with TB can die if they do not get the proper treatment, and we are seeing 38% of the deaths in TB around in the whole world that is occurring in our country. It means we are not giving the proper treatment and the diagnosis. We need to keep our immunity strong, so take the healthy diet. In the healthy diet means do not lose the weight so fast. Take the healthy carbohydrates, protein, restrict the fat, and eat a lot of fruits and vegetables. Colorful, make your plate colorful. If there is a history of cough for more than 2 weeks, weight loss, it's a very common symptom, and in the cough, there's a product cut with the blood, low grade fever, do not ignore it. Go to the doctor and visit. Get blood sugar check done, as diabetes is a very important risk factor. Multi-drug resistant TB is a matter of concern because persons are not taking proper treatment and the bacteria becomes resistant. So the treatment is to be under medical supervision. Before stopping the treatment, please consult the doctor. And how we can keep our lungs healthy: by breathing exercises we talked, no smoking. These are the some ways, and the regular exercise which will keep our lung healthy. So thank you for your patient hearing. Have a great day. Now session is open for any questions.
Thank you so much, Vineet Banka, for such an informative session. And I request everyone, if anybody has any question, please ask. Otherwise, we are good to conclude with the session.
Hello, I'm audible, sir.
Yes, yes, sir.
Yeah, thanks for your insight information. So just I have one thought. So where my father is infected TB, so he's under treatment from the last 3 to 4 months. In between, he doesn't take proper tablets. So now it is again going to some symptoms as getting increased. He feels like fatigue and energy loss like this. So this I suggest to give some suggestion on this.
Um, so one very important thing is we should not take irregular treatment. If irregular treatment is taken now, one thing we'll not count that part. So we'll count the fresh regular treatment and whether this treatment is effective or not. So if this, even after, how do we know? Generally after 3 to 4 weeks, persons become clinically better. If a person is not becoming better or maybe becoming further tired or a fatigue, that means the treatment is not effective. Then we need to get various tests done whether these medicines are effective or not. And if these medicines are not effective, then we need to change the medicines. So that means that is going towards the multi-drug resistance or drug-resistant tuberculosis. So if he or she is taking a treatment and not getting better in 3 to 4 weeks, please please get the test done so that we know whether we are dealing with a drug resistant TB or normal TB.
Okay, okay. Thank you so much. Yeah.
Yes, Sundam, please ask.
हाँ, व्हाट आर द गुड इंग्रेडिएंट्स अवेलेबल इन कीवी? जैसे आपने बताया था अभी कीवी कीवी फ्रूट्स, व्हाट आर
Kiwi
द
fruit.
गुड? हाँ,
Kiwi fruit, sir. Kiwi fruit is very good in this. Kiwi fruit is like blood thinner. Like in the heart patients, generally we
हाँ,
give a blood thinner because there is a in the heart disease. What is happening? There is
हाँ,
clot forms in the blood vessels.
yes, okay,
So, so clot forms to be, just to prevent it blockage, basically block na ho clot se.
हाँ,
So we
हाँ,
give blood thinner medicine.
हाँ,
And kiwi is a natural fruit which is a blood thinner. So kiwi is a
oh,
very good fruit.
अच्छा अच्छा, so instead of atorvastatin we can use this kiwi, is it?
Yes, yes, you can say definitely yes.
I see. Okay, thank you.
Welcome.
So, do we have more questions? Or otherwise, we are going to conclude this session.
If there is a limb TB, how long the treatment should last?
Um, is this a limb TB, which is basically leg, basically same bone?
Yeah, in the throat.
In the
Throat,
Throat.
throat, throat,
throat. Throat,
throat,
but it's not,
CHROAT.
throat is the laryngeal TB. Normally that takes roughly 6 to 7 months only, but the other infections may lead to sometimes 10 months, 9 months. So it depends. Lungs generally by 6 months it's over, but still before stopping the treatment, please consult the doctor. Doctor will see whether these things are fine or not, because in some cases even 12 months, even 16 months, 14 months we may have to give a treatment. So generally, but the throat infection, it generally takes in the 6 to 8 months.
Okay.
But how we can predict that the germ is already is not there at all?
Yes, we can do these NAT test nowadays, which is available. Gene test is there. With that, we can do it. And the appropriate, we also see the clinical part, the any whatever illness was there. There was some swelling, so that swelling has subsided.
Okay.
There are many other tests like CT, MRI, depending on the individual levels, what was there previously. So it depends on that also.
Okay. So doctor will decide.
Yes, yes,
Okay.
definitely.
Okay. Thank you, sir.
Welcome, sir. So, Dia, can we conclude if there are no more questions?
Yeah, I guess we are good to conclude with the sessions. Again, if anybody has any questions, please ask. Okay, thanks
I
everyone for
think we
joining
are
this
good
session.
to conclude. Yeah. Thank you everyone for joining in.
Thank you, Dr. Vineet.
Thank you, Dr. Vineet. Thank you.
Thank you.
Thank you so much, sir.
Very well.
And thanks everyone for joining the session.